Do you want to hear a crazy fact that most parents never hear? Within the first year of life, your baby's brain will double in size and form over 1 million neural connections every second, making this the most critical period for neurological development they'll ever experience. Yet, conventional pediatric care focuses only on whether babies hit those basic milestones within a certain time frame, completely missing whether their actual nervous system is functioning at its best. And don't get me wrong, milestones are important, but let's look at them from a different perspective. We're going to get a little nerdy here. Are you ready? According to the Harvard Center on the Developing Child, the first year of life represents when neuroplasticity is at its peak, signifying one of the most rapid periods of brain development in the human lifespan. And during this time, your baby's brain undergoes extraordinary neuroplasticity, creating the fundamental architecture that will then influence every aspect of their health for the rest of their life. But what is happening in traditional pediatric offices across the country? Its parents are expressing concerns about feeding difficulties, sleep issues, excessive crying, or developmental quirks, only to be told that these are normal variations, or they want their parents to wait and see if their child grows out of them. Now, this approach completely misses the critical window when neuroplasticity is at its peak and gentle interventions can have the most impact. A baby can technically pass their developmental screening while compensating for underlying neurological dysfunction through tension patterns, asymmetrical movement, or skipped developmental stages that will then impact them for years to come. And your baby's ability to breastfeed effectively is actually the first major neurological test, requiring coordination of multiple cranial nerves, upper neurospinal alignment, and precise timing between the nervous system and neuromuscular coordination. So when we see feeding difficulties like shallow latch, frequent popping off, gasping during feeds, or even a baby who becomes excessively exhausted while eating, these are often early signs that the nervous system needs support. Head control development between 8 and 12 weeks indicates proper cervical spine and deep neck muscle development, while challenges like persistent head turning to one side or even difficulty with tummy time can signal early neurological dysfunction. The most neurologically significant milestone is actually crawling between 7 and 10 months, which is going to establish the cross-pattern movement that stimulates balanced development of the corpus callosum, building foundations for later skills like walking and reading. Multiple stressors can accumulate and overwhelm a baby's developing nervous system, creating patterns of dysfunction that persist long after the initial stressors have passed. Prenatal stressors include chronic stress during pregnancy that most women are experiencing, and this affects fetal brain development. But there are also birth interventions like Pitocin inductions, forceps, vacuum delivery or C-sections, and even positioning issues that can place significant pressure on a baby's head and neck. Environmental stressors after birth, like disrupted sleep patterns, overstimulation, early antibiotic exposure, and feeding challenges, continue to stress an already vulnerable nervous system. This is going to then push babies into sympathetic dominance where they get stuck in fight or flight mode. And your pediatrician might check off that baby can roll over at 6 months, but they're not actually assessing whether the rolling movement is symmetrical, coordinated, or built on proper foundational development. Conventional pediatric care consistently overlooks the assessment of subluxation and dysautonomia, the neurological interference and imbalance that can develop from the perfect storm of stressors. And we've talked about these stressors many times, and these foundational problems rarely show up on standard tests, but can actually profoundly impact how well your baby eats, sleeps, develops, and regulates their emotions and behaviors. We use advanced insight scanning technology to objectively assess your baby's nervous system, and we're doing that through gentle, non-invasive scans that are going to measure things like muscle tension patterns and temperature regulation. So these scans give us a clear picture of where stress and dysfunction exists in your baby's nervous system, showing balanced, symmetrical patterns in healthy infants or areas indicating stress that need support. And rather than waiting for problems to develop, we take a preventative approach. We're going to be supporting optimal nervous system function from the very beginning when neuroplasticity is at its peak. If you sense in your mom and dad gut that something isn't quite right with feeding, sleeping, or development, and you want to ensure as a parent that your child has the strongest possible neurological foundation from the very beginning, click the link in our bio to learn more about neurological development.